Good evening, ladies and gentlemen. Could we please start with the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. That was 6 o'clock. You can hear the fire bell in the back. We're right on time for a 6 o'clock start. I'd like to welcome you this evening. This is our third Facebook Live meeting that we've held. It's a pleasure to be back in our building at Central Office and be able to now run our meetings live. We'd like to thank Tucket TV for their generous donation for making this happen, working with our tech team, so that all board meetings moving forward and anytime we want to do something live on Facebook, we'll be able to do it from our headquarters. That being said, we were getting requests to hold another live meeting, and we felt it was important. We are in our fourth week of school at this point, and obviously you've had communications from your building administrators and from my office regarding the status of our buildings and where we're at and how we're safeguarding and moving forward. So that being said, I just want to do a couple of housekeeping updates to everyone here. We will be talking about our elementary schools this evening, and we will then on Thursday evening address NBIS and the high school with any specific questions there. You can feel free to send questions in on Facebook this evening. We have Bruce Williams, our tech director, who is monitoring any incoming questions. He will share them with us. Our COVID director, Carter Wells, will be reading questions that have been previously sent in, and then we will all work together to answer those questions specific to a building or location. So firstly, for hygiene and cleaning, I had been mentioning the backpack sprayers that were on back order, and we had ordered them several months ago, and we're waiting, and we ended up changing an order and getting them in, like I said, about a week or so ago. They did arrive, and we have 2 of the backpack units in every building. I have them here if you can take a look and pan here. So each evening, the shift will have 2 of these running where there are 2 custodians. They are very effective and efficient. We're getting great reviews on how quickly we're able to go in and sanitize a room. So that being said, that was something that we had mentioned, but I know there were a lot of questions about the sanitation during the evening. Keep in mind, we're continuing with our daily routines of having our sanitizers in every building. They work with our day custodians. We still have our evening shift custodians coming in early. I believe we shifted their hours to 12 to 8 now. So they're in the buildings during the evening when there's no children there and they have more time to thoroughly clean. So that being said, during the day we have at least 3 and potentially 4 people cleaning, and then at night we go to our 2 to 3 team shift. We just hired a full-time person that will split between Tucket Valley and Jerome Harrison, and they started this week. So we'll get an additional 3.5 hours of cleaning in each building as well. So that being said, I'm going to turn the program over to Dr. Welch. She'll start with the questions, and we will take any questions as we move through.
All right. Welcome, everyone. Thank you for allowing us to continue to kind of reach out and collaborate with you about what's going on. We appreciate your questions that have been shared ahead of time, and we know more will come in as we continue. I think really the major questions that are being asked at the elementary level come around contact tracing and quarantining. So those are really 2 of the major issues. So to give a sense, and speaking on behalf of Beth Parker at Jerome as well, I think at the elementary level, the contact tracing will look a little bit different. When there is a positive case, if that happens at the elementary level, our entire elementary classroom would be quarantined. Now that's slightly different than what's been seen at the high school or the middle school, where they're really looking at the 6 feet and the 15 minutes of prolonged exposure. At the elementary school, because our students are in such close contact, because the spacing when kids line up, when they're transitioning, eating lunch, the things that we have in our elementary schedule, even though the desks may be 6 feet apart at times, we cannot, with confidence say that there hasn't been that 15 minutes of shared time. So the quarantining would occur for the entire class. We've said that pretty much all along, so that hasn't changed. With the contact tracing, just simply because of that, that would be a relatively simple process. We would quarantine and put all of those kids together at home on remote learning. That said, we would look at bus, obviously, at our level. That would be an important part if a student's involved in the before or after school program, FRC. And then I know specific to Tuttauquet Valley, we would look at our 4th and 5th grade model to the shared teacher that works with a classroom. So there are kids get a language arts teacher and a math science teacher. So we would look at the level of exposure of that teacher as well. Second to kind of those questions about contact tracing and quarantining, we have gotten some questions on masks and our remote learners. So I think speaking specific to Tuttauquet Valley, we have staff that service kids who are at home remote learning. When they are servicing students in front of them, they are masked the entire time. That's our expectation for all students and staff in the building. There may be times if there are kids with speech or language issues that you might see a teacher in a plastic face shield if they're able to get 10 or 12 feet away from students. So that might occur at times. Typically, if they are not at the 10 or 12 feet, we would expect them to be in a face shield and a mask. Lastly, I would say we do have the option with the way that we're delivering our remote learning model at TVS to have one of our teachers or staff members Zoom with kids live in a private office, in which case, if the teacher is working with students in that venue and they're not around other students or staff, the teacher will have their mask removed at that time to communicate through Zoom. I don't know, Beth, if there's anything that you would echo or if that's a similar model.
No, I would say that's a similar model.
Okay. So just kind of going through some of the questions, I'll hit on a few that are really specific to me, and then I'll turn some over that are more specific to Mrs. Tirolo and kind of the nursing piece of it.
I want to just speak to the tracing piece. You are aware the only building at this time has been the high school where you had 4 students that were tested positive for COVID. And that started on September 17th. We had our first positive test. You are aware that it was our field hockey team that was quarantined. There were 19 field hockey players that were quarantined for the 14 days. 4 of the field hockey players tested positive, so they were isolated. We were able to trace and find the source from that and where it came from. We work directly with East Shore Health. So what happens? We go in and there's seating charts for every student in the district, and we'll physically walk into a classroom and look at any student that sits within 6 feet of the student who tested positive. We'll do that for every class. We check with transportation, then we go to any extracurricular sports, and in this case, it was our field hockey team. So of the 19, we had an additional 20 students who were identified that went out. So we had 39 students from the high school that were out of the academic and athletic arena for 14 days. Now, I'm guessing right now at this point, 35 have returned to school safely and have been cleared. There were a couple that had to go 2 or 3 extra days because of when they went out. So all by the middle of this week or by Thursday, all 39 students will be back. And we work in concert with East Shore Health to make sure that we are following the process. We are sending all of the contact information to East Shore. They then reach out on a secondary level and expand the search if they need to, or they notify us and say, no, this looks good, and you've done an adequate job. That being said, I will continue my communication when there is a positive test. We had a staff member at NBIS, which then 5 students were sent out for 14 days and 10 staff members additional to the 1 positive that fit that criteria. So I will continue to let the entire district know when it is a full-time student or a full-time staff member or any staff member that has contact with any of our students or with staff as well.
All right, so to go through just a few of the questions, one of the questions that came up was about remote learning and if that remains an option for the entire year. Currently, the state has allowed that to occur, but we don't know the status if that's a long-term. I don't know, Mrs. Wooten, if you want to jump in on that one.
The state has called it a temporary option, and in addendum 1 to the state plan, it does say that the state has the right to change that option at any time during the school year.
Right. So we, as the district, would honor that as long as it's offered by the state. If the state pulls that back, then we would have to obviously, reconsider how we're delivering things in the district.
It really, and from the information that we're getting and we're seeing with the Commissioner of Education, the resources are so slim right now. Schools will be closed because they can't find people to fill classroom for instruction or supervision. When you look at NBIS with the positive test and having 10 certified and non-certified staff go out, it was miraculous that we were able to fill gaps and get people in for those 2 weeks. And that has been the point that all superintendents that I've been in communication with and what I've seen is that it's the staffing issue if they're quarantined. So I think they're looking to more guidance with how long this is going to go on, where students opt out because it's obviously stressing the current resources that you have to send instruction home. And if they're doing both live teaching and streaming, it's taxing on the teachers, and we're having a very difficult time finding substitutes in all areas. So if you are interested in working in the North Branford Public Schools, I'm going to put this out there to you right now. We have opportunities for paraprofessional substitutes. Please go online, and if you are looking to get out and start a career and work with a great staff and great children, we'd love to entertain that. Okay. That was my segue. Back to the questions.
Back to the questions. All right. Some specific ones. One came across about being concerned in the winter months about air quality in the schools, and if the windows are shut and the heat's on, could air purifiers be purchased for classrooms? Unfortunately, air purifiers would not be part of the plan. That's something that CDC and our state reopening plan does not suggest as a good strategy. Apparently, there's concern that they trap particles if there is transmission of bacteria or virus. So those would not be used. I think our plan would be to continue to use the open windows as much as possible, being mindful of the temperature and keep that airflow with the classroom doors open. Perhaps using the air conditioning fans as well, not the air conditioner itself, but the fans to transfer air. An additional question about outdoor spaces. Is there a plan to continue use of the tents? In talking with Scott, that's something that we only have temporarily in place. As the weather gets colder, we would not continue and purchase those and have those outside. When students are quarantined, the question came up, are they given guidance from the schools or the district on what they should be doing and should not be doing? So specific to families related to kind of the healthcare piece, they are given through eShore Health and our school nurses kind of a chart to document their temperature and symptoms over the time of quarantining. They are given access through the administration or the staff assigned to that responsibility, access to remote learning while they're in quarantine. And I think in kind of considering this and talking with parents and guardians, an additional step might be that we send home something specific about while you're in quarantine, the expectations for students might be these. So we remind students to not be out and about in the community, interacting with other students, to remain home, remain quarantined, safe, limiting their interaction. So that just might be an additional follow-up that we include going forward with our written communication about quarantining. Question again on outdoor. What are our district plans for outdoor mass breaks or outdoor fresh air time given the cold weather? I think that's something that all administrators are thinking about, what we would do in those cases. I know at Tucket Valley, we have recess outside until the temperature drops below 20 degrees, so we would continue to kind of push to get outdoors provided we can. We would use, weather permitted, we have that outdoor awning space in the front of our building that serves as a good place for kids to get outside and get fresh air and take mass breaks. But I think all buildings faced with those weather challenges are going to have to come up with plans where they use the gym or the cafeteria, large spaces, to get limited mass breaks with small groups of students. So all of us will be evaluating those and coming up with plans as those days are unfortunately probably coming sooner than later. Let's see, other specific questions from my end. I think what I'll do is kind of shift it to Mrs. Turlo to kind of answer some of the more specific nursing questions. And then I know there's a couple that are geared specifically toward Scott as well.
I want to piggyback off I have the tents rented till November 1st. From what I'm hearing, we're getting less usage of the tents, and we'll evaluate that. But November 1st would be the date that those would be removed, unless we felt that we wanted to hold on to those for another month. Obviously, with the weather changing, kids will still continue to go outside in all buildings, even if it's for 5 minutes, just to get out and move and get back in. And we'll monitor that as we move along.
Sure. I will say at Jerome Harrison, we use them quite frequently, and it's working out really well. Our classes are outside 45 minutes a day in terms of the homeroom, as well as our specials are outside, during the tent time. So as long as we can keep them, and obviously weather permitting, I think that's working well at Jerome.
Good.
Okay. The first question was, if a student is placed in quarantine, are they required to provide a negative test result before returning to school? They are not. Once your child or a staff member has served their 14-day quarantine, as long as they are feeling well, they have no symptoms, they're not taking any medication like fever-reducing medication, acetaminophen or ibuprofen, they are free to return to school. You do not need a note. We do ask for a copy of the test result, though. We would like to have that in hard copy, or if you can email it to your nurse, we need to keep a copy of that in the chart. And just piggybacking on that, the nurses have asked me to remind everyone to please make sure, if your child is sent home because they've had symptoms, please make sure they return to school with a doctor's note or a negative COVID test if they've had one. The next question is similar. If a student had a positive COVID test result and is staying home, are they required to be cleared by a doctor before returning to school? That's basically the same question. They are not. If they've had a positive test and they have served out their quarantine time, they can return to school when symptom-free. How is contact tracing done when there is a confirmed case, and how do you ensure that all students that were in contact with the person are quarantined? I think both Mr. Schoonmaker and Dr. Welch have already alluded to that. We have a very specific plan in place. We have a template that is started immediately when a person is identified as being positive. Typically, a parent calls either the school nurse or the principal to let them know. We notify the superintendent, and we notify East Shore Health immediately. We then put into place our close contact tracing. So we take out the seating charts of each of the classrooms. We physically visit the classroom to see if students or the affected person has been within 6 feet of the positive case, and then we begin contact tracing by that. We also, as I mentioned, look at the buses. We look at where the children are sitting on the bus. Each bus has a written plan, has a written diagram of where the children are sitting, so we know who has been in contact with each other. We then send home a letter, which is probably coming either from the principal or Mr. Schoonmaker, stating, and a direct phone call stating your child has been in close contact with somebody who was tested positive for COVID-19 and that they are now put into quarantine. We send home a complete letter following that, and the following day you will receive an email from the school nurse or from someone else in the building listing all of what we've already mentioned, and including a symptom chart that requests that you take notes in case East Shore Health calls on you in regards to symptoms. We also ask that you continue to take your child's temperature twice a day and call the school nurse or East Shore Health with any concerns. So we're basically doing the contact tracing within school, and East Shore Health is going to call you, so please pick up the call, because they're going to follow up with contact tracing more community-wide. Have you been to church? Has your child been to CCD? Are they on any sports teams outside of school, like a rec team? Have they been in contact with friends or family? things like that. So they're gonna follow up with you about that. And that is how we contact trace. It's a very concise, clear model, and it's worked out well so far. The last question,
Before we
yes.
go to that next question, it's really important that families know that the confidentiality of your student is our highest priority. We'll have conversations with East Shore Health that are very specific to age, gender, location, all of those things. But when we do a press release, it's a member of our school community. We do not give any information out for obvious reasons, for HIPAA and other things that we really value as how we handle this and the manner in which we do it. We do get questioned frequently. You'll see news agencies parked outside of our school grounds. You'll see articles in newspapers, and they're constantly looking for a story. It's unfortunate, that's the world that we live in. We will not give them that story. I am the spokesperson for the district, and I will always maintain confidentiality for our staff and students. And it's important that you know that.
Okay. Next is, what is the specific role of East Shore Health in determining district steps in quarantine? So East Shore Health has been working directly with our administrators and the nurses from each school. In fact, I hear from them every single day. They're checking in, they're asking questions, they're asking us if we have any questions, and they're readily available when we call them. So they provide guidance for all of our known cases as to who needs to be quarantined. We toss back information between each other about the length of quarantine, just to be sure we're all on the same page. And then they assist with reviewing our lists, our clubs, our sports, anything that affects your child, so that we be sure that we have gotten everybody who needs to be quarantined. So they are very involved, and they only cover 3 towns, so they're very available to us, and they've been great to work with. And lastly, how does East Shore Health determine contact tracing protocols and steps? The same as we've already discussed, per the Department of Health and the local school system. We work together in getting all that information. They have their own form of contact tracing, like I said, where they're in charge more of the community, whereas we're in charge more of what's going on in school. So please be very mindful when your child or when you are put in quarantine, you're to stay home. You're not, the kids shouldn't be out, they shouldn't be in groups. They need to stay home if we're gonna contain this. So please be mindful of where the kids are going at night and make sure that they are staying home. And that is the last question I have. Did one more though came in, correct? Earlier, or do you want to?
Yep, one more did come in. It was, if a parent is awaiting a test result, particularly if they're not feeling well, should that parent's child stay home until a result is in?
So what we do in a situation like that, if a parent is being tested, it basically comes down to, was that parent in contact with someone who is positive? If that parent has been in contact with someone who's positive, then we are following the addendum 5 that you've all received at home, and that person, we're going to request that person be tested. We can't force them to, but they will probably be put on quarantine because they have had direct contact with someone. However, if that parent has not been diagnosed as positive for COVID-19, the children are allowed to come to school if they have no symptoms. So that is your decision. If you decide that in your home people just aren't feeling well, then as normal as any other year, please keep your child home. Obviously, if they have 2 of the more minor symptoms or 1 of the more major symptoms that we've discussed in the letter that we sent home, please keep your child home, because if they complain and they're not feeling well, they're going to be sent home anyways, and then you're going to need a doctor's note to get them back to school. So if someone has not been tested positive in the immediate family, then yes, the children can still come to school. Should mom or dad come back as positive, we'll be in touch with you, because they will be asked to stay home, especially if they have symptoms. And they will probably end up getting tested too, if that's what your pediatrician recommends.
And I think, going off of what Mr. Rella just stated, that we are going to be going into our flu season, and with allergy seasons now, and many people being symptomatic for, which could be anything. There's going to be obviously a heightened sense of of urgency to find out exactly what people have and what they're doing. So we really expect the winter months to be really interesting for all of us. Not that they haven't been interesting up to this date, but with flu season and other just common colds and things, we're all on heightened alert for any of these indicators.
And I have to say, the parents have been great about us calling at all levels of the school. And I know it sounds like they're minor symptoms and they are allergy symptoms, but people have been great with understanding and saying, yes, absolutely, I'll pick them up, I'll take them to the doctor. And some doctors are recommended a COVID test, and a lot of parents are allowing that to be done. They're being great with getting the notes in. They're being very understanding, so we appreciate that because we know that's a lot of work on your part. And please also remember to send the children in with a spare mask. There's still a lot of children coming in without a backup mask, so we do need those to be washed if they're fabric and sent back to school so that they do have a backup, especially if they have a little cold and maybe their nose is running or they're outside a lot more and they're getting dirty. So please be mindful of that and those temperature checks in the morning.
We have multiple PPEs available. Every nurse's office has a stock of extra masks, so I don't want you to worry if there's ever a need and you need excess masks. Please reach out to the school nurse and we can take care of whatever your needs are. I do have additional thermometers. I believe I have probably 100 in each building. Is it that high? I know I had another.
We've been handing them out lately, but we still have plenty. Just call and ask, they will send them home.
And that helps us, and as Nurse Rowe said, please be vigilant in doing a quick temperature check. It really assists us on our end if your child does come in, at least we know where they're at based upon that information.
All right, next couple questions are for you, Scott, so I'll ask away.
At least the 10-point questions?
Yeah, really. You saved the big ones for last.
Okay.
All right, first one is really, at what point would the schools have to shut down or move to a full remote learning model?
So two-part. I think, as I alluded to earlier, the staffing issue, the staffing concern, and that could happen if we had two situations where a staff member went out for a potential positive and it impacted 10 or more staff members that we had to quarantine. If there was another second positive and additional staff had to go out, we certainly would not be able to keep potentially a building open, or it could be a wing open. I know Dr. Welch spoke to a classroom being isolated. We would shut the class down, but the school would stay open. That could be similar in a building where we could work collectively to cover a grade, but we might have to shut a grade down because we have 6 or 7 staff members out. There's not a magic number for a school shutdown. When you look at the flu, in the past we would work with our medical advisor and the recommendation would be if you hit 30 to 40% for flu students being out, which is a significant number, you would then start the conversation. Obviously, we would not get close to that point to look at a school shutdown, but there's no hard number right now. And we've spoken with the health department and with our medical advisor, and we're kind of going through this as we learn more about it and its impact. I know that's not a definitive answer, but we'll stay open if we feel it's safe. We're not going to do anything to put a staff member at risk. When I say to you, we look into, when we err on the side of caution, when we put 11 staff members out at NDIS, anyone that even hesitated in answering the question of 15 minutes or within 6 feet, we sent home. And same with the students when we went in. It was 6 feet, anyone within 6 feet of these students, they went home. So we are being aggressive in how we're handling this. And it's day to day. We're not looking at this week to week or month to month. We are going day to day. And that's really the best we can do right now. You're looking at 4 weeks in with an isolated field hockey situation where we identified it, we knew its source, and we knew the time when everyone said coming off of the Labor Day weekend is when you're going to see additional upticks, and that's been true to form in Connecticut. If you look at East Shore Health in the districts that they serve, Branford and East Haven and North Branford, right now, in East Haven, there have been, since March when they started testing, 440 cases of positive tests. In Branford, since March, there's been 378, and in North Branford, there's been 98. So many different factors play into that. The number of nursing homes in those communities, elderly housing facilities has caused a great uptick for them in those communities. So there's many different factors that we monitor, hospitalizations, things like that, and then the metrics that the Department of Public Health uses to guide us. Obviously, if the governor makes a decision that we're going in that direction, I would think it would be similar to March when we completely shut down. I will say again, on record, that I'm not a fan of hybrid. I wasn't a fan of hybrid from the get-go. That was supposed to be the second step when you had upticks and when you felt like you couldn't do the tracing or control your situations to go to the hybrid. I think it's created a lot of stress on teachers and families and administrators trying to manage that, and I'm not confident that it's done anything to eradicate the risk. So that being said, it's something that we would entertain, and we're doing everything we can to distance and do mask wearing. And our administrative team have done an amazing job with our nursing staff to make sure that we're doing everything that we possibly can. That was a long answer.
You got a lot in that one. You did.
Did I get the next three?
Yeah, you did
Okay.
take care of a couple.
That was the 3-for-1 special we just did there, folks, but let's see what else we have.
All right, the next one is specific to people traveling. So is there a policy regarding traveling out of state for staff or students, and how do we monitor and enforce that?
So I'm holding in my hands right now the CADE policy recommendation that we are going to review. And it's really, it's so important for families to share information with us ahead of time. I can't emphasize that enough, that if you are going to a restricted state, we would ask that you notify us, and that whatever requests that we make of you upon return, that you would honor them. If it is with a 14-day quarantining, we would do the remote learning with you. I think families have been really good so far with that. And it's difficult at times because Rhode Island was on and then it was off a couple days later. So what does that mean? So that being said, we do have language. We are asking that families really refrain from, if you can, going to at risk. And certainly there's family situations that I understand. But anything that you can do to help us try to abide by and follow the guidelines of that. If you're driving through a state, that does not count. So if you're traveling through, if you're staying for more than 24 hours, there's a whole list of things that you can do to ensure that you're not putting anyone at risk of having to be quarantined. So I'll get that information. I'm looking to have this language adopted hopefully within the next 3 weeks of our board meeting, and we can address it there. The other piece, and I know that there's been outreach to the families about, the protocols for not only in school. When we look around, you look at what all of the districts are attempting to do, and we're lining our hallways and spacing our children and doing grab-and-go lunches. And, we have such a framework in place, but then what's happening is you see it throughout the country. The rules change on the weekends and after school and on holidays, and then it comes back into the walls of our schools. So I strongly encourage everyone to continue to just steer the course. Connecticut has done an amazing job, and we'll get through this if we continue to take those safeguards and take them serious. Would you agree with that, Mr. Rowe?
I would agree. The kids are doing amazing.
They are. The kids are the easy part.
Yeah, they've been
want to be
fabulous.
And they want to be back. They want to be in school.
They're happy to be back.
They're, going in March through the summer, 6 months of an extended vacation, it's not healthy. I think the The socialization and the social emotional piece in schooling for all children is as important or more important than any other aspect. And that's something that we constantly have to reflect upon when we're making these decisions to keep our kids in school. What it's doing if they're not here. We have to weigh and balance out the advantages, disadvantages with obviously their safety, of them not being around adults and around peers in all aspects of their education.
Next one just actually came in during the meeting, so
A live question?
Yeah, I'll take a stab at this one, and maybe if you fill in any others. It's really about bus cleaning, how often and when they get cleaned, and do we know what their cleaning procedures are. What I can tell you is at the school level, I've observed our buses pull in before they're picking kids up after doing the secondary run, and the drivers, when they pull up, are getting out of their seats, they're sanitizing and spraying down the seats and the doors and the high-touch areas on the bus. So they do that before our students get on to go on their afternoon run. And then I also observe the same practice in the morning. So after they've dropped off the high school, secondary kids, they'll come, as they're leaving, they'll sanitize our buses in the morning. So I think they're doing it as much as they can in between the runs of the different age groups. But every night, as part of, they have a deep cleaning procedure where all DATCO buses are cleaned thoroughly. I don't know if you'd add anything to that.
DATCO has a cleaning protocol standard that they use for all of their drivers and buses, and I can get that posted on our site so that it's available for the public to view as well. They are vigilant, and I'm echoing
Very much
what
so.
Dr. Welch has said. Many of them are parents,
Yeah.
and they truly care about our children's safety, and they care about their safety as well. So I think they truly are vested in doing whatever extra they can to maintain a really clean environment for our children.
And I guess, Bruce, I turn it over to you if you've got anything that came in. Those were all the questions that came in ahead of time to us or to me right now during the meeting.
I have 3 questions.
Okay.
One may be a little repetitive, but questions, when the children were out in high school in quarantine, did their siblings, their elementary siblings also get quarantined?
No. So I don't know if you want.
One at Jerome Harrison was.
So if it was a positive tested student, yes, then the four students who were a positive test, if they had a sibling, they were quarantined. The other 34 students who fell into that 6 foot, 15-minute range, their siblings would not be quarantined because they did not come in contact with a positive person. They're
Right.
considered 2 tiers away.
And the sibling that was quarantined at Jerome Harrison was tested. It was tested
It was
negative.
negative.
Second question. Interested to know if additional guidance has been given from the state regarding the number of sick days.
Number of sick days.
That the children can have before they become.
Yeah, probably attendance policy. They had the 9 days typically.
So the attendance policy has not been officially changed by the state, but what they've done is redefined what it means to be in attendance. So if you are in virtual remote learning or in person, you need to attend to school for at least half of the day.
So we have a formula that we're not going to penalize a student, one, if they're quarantined and we're sending them home, or if they opt for remote and they're actively participating based upon that 50% formula, they will not be penalized with absenteeism. I don't know if that answers the question or not.
It does.
Okay.
If there are snow days, will there be remote learning days?
If it was up to Mr. Schoonmaker, we'd never have another snow day, ever. So the commissioner has to make that decision, and it would be based on equity for all districts to provide remote learning. So that means every town or township in the state of Connecticut would have to fully be able to ensure that every student has the same opportunity with connectivity and with a device to be home and to be getting a full day of instruction. And if that standard cannot be met, we will not be able to use remote for a snow day.
Final question deals with Jerome. My son was out for 2 days of school, but was able to log in and do their work with the class. Does it count? Now, it doesn't specify whether they're out sick.
So no. I think it was I believe it was for the student who was out prior to, they were getting tested, but the test results were not back yet. But no, that wouldn't count.
Count as an absence?
Because they weren't remote, they hadn't been switched over to remote learning. If the child had to be quarantined, then that would count. Am I correct, Tracy, on that?
Yes, the state had suggested that we do not do an a la carte type of education. So we ask that parents try to give 72 hours notice. Obviously, in the case of being ill or quarantining, that's a different situation. But we ask also that there's a minimum, we're expecting 2 weeks, especially for students that are quarantined or that are ill. So it is not, if you are out one day, you are not going to be on remote learning. In order to be on remote learning, teachers have to put you on remote learning so that they make sure that you have the materials and the instruction you need to actually get a day of instruction.
I think in this particular case, it was a student who was already in a virtual learning classroom, and so therefore the student could log into the live stream as the live stream was already available to the student. So in that case, I think that's fine, obviously, to be able to log in to have the instruction, but in regards to attendance, again, unless there's a prolonged period of time.
And I'll echo what Ms. Wu just said. We're looking for consistencies because kids that opt in, opt out, check in, check out,
Right.
Creates chaos. And for management, I mean, this is taxing everyone right now with, a small percentage. We're running about 10% of our student population being at home. So we're looking at 170 students that we're educating, from our schools. If that number, if we were able to give flexibility and those numbers changed, we don't have the resources to manage it.
One final question just came in. Net gators, are they acceptable?
No. So I will answer that one. And that was another, and I know Dr. Welch authored and we put out a letter regarding neck gaiters. Originally, they were acceptable, and then further studies showed that the microbes, I don't even know if is that a word?
Yes.
Particles.
All right, let's go.
Droplets.
Droplets, there's the word.
Droplets. That droplets were able to permeate the gator, and it was recommended by the Public Health Department, the CDC, to stay away from a few different variations, and the gator being one of those. So we did notify them, and we gave enough time. We gave a week's notice for families to transition over to masks, acceptable masks, but the gaiters were taken off of the list as an option to wear. I think, quite frankly, and honestly, I think a lot of the students were drinking through their masks, were taking them down, and were turning them more into a stylish piece than an effective manner in which they would contain their particles. So I think that they were not only scientifically in question, but they also were not very popular with the staff members because they were constantly having to remind the children not to drink chocolate milk through it.
And that's a great example of how we've said from the beginning that guidance changes day to day, and what is a rule or a fact today is possibly not tomorrow. So just to bear with us as things change all the time. I just want to be clear about when we talked about not knowing if you should send your child to school because maybe somebody's being tested. If you have any questions at all, we would rather you keep your kids home an extra 10 minutes in the morning and call the nurse and just ask for their guidance. They've all already had quite a bit of experience with this, and they'll answer your question and tell you if your child needs to stay home or if you can send them to school. So if you're not sure, just call. We're here to answer your questions will guide you in the right direction.
Good question.
They're coming in.
They're hot now.
Yeah.
How many viewers do we have? Do we know?
85.
We'd like to thank the 85 viewers out there this evening for tuning in.
So if a child has more than 2 symptoms that requires them to stay home, go to the doctor for school, which will happen multiple times throughout the fall and winter seasons for allergies and common colds. What if those add up even if the child is deemed safe to go back to school? Will they count?
We're going to be
yes.
really flexible.
Absolutely.
And that parent that's asking that question, I understand. And I mentioned earlier about going into flu season and going into allergy season and, itchy eyes and a runny nose, constitutes a trip to the pediatrician to get clearance. And that can happen, several times. So we're really going to work with our staff, our students and the families. This is new terrain for all of us, and we're looking to support and our families and know that this is going to be as taxing and trying on them as it is going to be on us. And we just want to make sure that we're doing everything as we're obviously being told to do, but in support of our families as well. I don't know if anyone wants to piggyback off of that.
Oh, absolutely.
No, it's true, and like I said, people have been great. I was worried about that. When we had to send out our guidance of sending children home with 2 seemingly very minor symptoms, I thought, oh boy. But we have to be black and white in order to keep everybody as safe as possible. And I can only speak for my own school in this regard, but the parents have been great. I mean, there's been minimal kickback, and they've been very cooperative and very understanding. And like I said, the kids have been amazing. And I think that's across the board. I mean, they've been way better than I ever thought they would be. It's been going well.
If there is an issue with attendance, the schools will reach out to our students and then they will make plans with the families if they're appropriate.
That's it.
That's it.
Any other closing comments from any of our COVID team? So if you're not aware, Thursday evening is our next scheduled event from 6 to 8. We'll be talking about questions pertaining to North Branford Intermediate School and North Branford High School. So feel free to view again if you have any questions that come up over the next 48 hours. Obviously, either you can send them in or just go on again live and send them to us live on that evening from 6 o'clock on. And we thank you for your continued support.